This is Christian Gomez with the New American Magazine, and on the show today with us is Dr. Vladimir Zelenko. Dr. Zelenko, thank you for joining us today.
Thank you for having me. I appreciate it.
So, Dr. Zelenko, your name has become quite a media sensation, especially with your use of hydroxychloroquine, the malaria-fighting medication, and your success rate when it comes to using it on patients that have been diagnosed with the COVID-19. So, Dr. Zelenko, can you tell us a little bit about how you came about to using the hydroxychloroquine initially and your success rate?
Here, doctor, for a community of 35,000 people that live within a square mile of each other in upstate New York. And so there's a very high population density. And I knew that when the viral infection would come to the community, that it would spread very quickly because of the population density. And at that point, this was in early March, there was globally the whole emphasis on dealing with this pandemic was to build more respirators, hospital capacity. There was zero emphasis on developing interventions, treatments in the early phases of this illness to mitigate the course of the disease and prevent them from progressing to those terrible pulmonary complications and then ending up on respirators. But that didn't seem very like a very good approach. So I started thinking about finding an approach that would be useful for a primary care doctor, basically a weapon, a bullet that we could use early in the process to basically put the fire out or to kill the infection very early in the course of the disease. So I looked at world research and I saw how other countries had taken, what approaches other countries have used. So in the Far East, namely China and South Korea, they were using hydroxychloroquine with zinc. And in France, Marseille, France, WDA at that time was coming out with studies that hydroxychloroquine and azithromycin was promising. So that's kind of the information I had. But everyone there was using these medications in the very sick patients in the hospital setting and so on. So I decided that these medications I'm very familiar with. Azithromycin is one of the most common antibiotics in the country. Hydroxychloroquine I've used for 2 decades with my patients for rheumatological diseases like lupus and rheumatoid arthritis and for malaria prophylaxis. These drugs I was very familiar with and very comfortable with, and I know their safety profiles. And in the case of hydroxychloroquine, it's been around for 70 years and treated tens of millions of people already for malaria and malaria prophylaxis and the rheumatological diseases, with no major known complications, regardless of what the media says about the risk of arrhythmias and QT prolongation with hydroxychloroquine. That's just nothing more than fear-mongering. I'll explain that a little bit later. So I started studying the basic science of how this virus works. So like all viruses, a virus cannot replicate or grow on its own. It needs to get inside a cell, and when it goes inside a cell, it steals the resources of the cell and uses those resources to replicate, to reproduce. And in the process of doing so, it kills the cell. So it turns out that zinc is well known that it inhibits viral replication, and specifically in the cytoplasm, in the inside of the cell, there is an enzyme which is called replicase, and it's used by the virus to make copies of its genetic material so that it can make more virus. And so this enzyme is essential to viral growth. Turns out that zinc inhibits that enzyme. It deactivates the enzyme, and so it makes it very difficult, if not impossible, for the virus to grow. The problem that we have with zinc is that it doesn't get into the cell at all because it's like oil and water. Zinc is a positive charged ion that's dissolved in the plasma, and the cell membrane is essentially cholesterol. It's made up of a phospholipid bilayer, essentially. So what that is, it's oil and water. So even though zinc is effective against the viral growth, but it cannot get into the place where the virus is. So what does hydroxychloroquine do? In this case, it's nothing more than opening a door, a channel, a zinc transport channel called a zinc ionophore, and it allows for zinc to go from outside the cell to the cytoplasm, to inside the cell. That's all it does.
So for people who, let's say, don't have the coronavirus, at least as far as they know, they don't have it, or for people who maybe suspect they have it, but again, haven't been tested for it, would taking just a zinc supplement on its own be useful or not, since it can't breach the cell membrane walls like you mentioned?
I don't think it would be useful.
Okay.
So let me just finish the derivation. So so hydroxychloroquine and zinc, they need each other, and basically zinc is the weapon, and hydroxychloroquine delivers the weapon to the battlefield. Now the antibiotic is there for two reasons. One, it actually has antiviral properties, but two, one of the major complications of COVID-19 is the development of pneumonias and catastrophic lung injury associated with that. So because damaged lungs from viral infection become more susceptible to secondary bacterial infections. So the antibiotic is there in part to prevent bacterial infection. Basically, there's three drugs. Each has a role, each has an antiviral property as well, but it's the synergy of them, it's the combination of the three of them, and using them in the right time frame, which is key to the resolution and treating this disease.
So is there a stage when it's too late for a person to take the combination that you just described?
The later someone starts, the more difficult it is to put out a fire. In other words, it's easier to put out a small fire than a big fire. I think you understand that. And if you look at other viral infections, like let's say influenza virus, so the recommendations everyone knows, right? You have to start Tamiflu within 48 hours, because after 48 hours, it's not effective. Because at that point, the fire is out of control. The infection has spread significantly. So the key is to start very early. Or the same thing with herpes, same thing with HIV. Really, same thing with any other medical emergency. The sooner you deal with it, the easier it is to treat it. So, for example, if someone has an infection on their toe, I'm not going to wait for them to become a septic and in the ICU before I treat them. I'm going to treat them in my office with antibiotics right away, but it doesn't progress. So it's not a controversial idea in medicine to treat. It's common sense to treat a disease or infection earlier than later. Now, let me tell you some little more specific properties of COVID-19. We've learned that within the first 5 days of symptoms, the amount of virus that is within the person is relatively small and stable, meaning it's a small fire. By day 6 or 7, it is an inferno. It explodes for some reason, and then it becomes very difficult to treat. So if you think about it, you can even think about yourself. I mean, if you're not feeling well, do you go to the doctor right away? The answer is no. Most people who have a fever and maybe a runny nose or feel weak, they're not going to go to the doctor the first day. They'll say it's a cold. Let's see what happens. They wait 2 to 3 days, and in most cases it goes away. But if it doesn't go away, the statistics are that usually patients present on the 4th day or 5th day of not feeling well. So think about this. So here you have someone with COVID-19. They come day 4 or 5, and still they're not that sick because the viral amount of virus in the viral load, the amount of virus in the person is relatively small. And they say, I don't feel well. And a good clinician, a good doctor could easily diagnose COVID-19 based on symptoms. For example, very few things in medicine make your smell and taste go away suddenly. And COVID-19 does that. And COVID-19 causes fever, bad cough, body aches, similar to the flu. And the it's pretty easy to differentiate the flu from COVID-19 because you can do a flu test. If the flu test is negative, well, you know it's not flu season, then it's obviously not the flu. And if a person's been exposed to COVID-19 and let's say his entire neighborhood has it or his family has it, you don't need to be a rocket scientist to understand that the patient has COVID-19. So here's the key. The key is to initiate treatment on day 4 or 5 immediately, even before you get the results of the test. I'll tell you why. Because it takes 3 days to get the results of the test. If you come to my office on day 5, I do the test, and I wait till day 8 for you to get the result, at that point, the virus is out of control. So we're stuck. If we had a test that could be done in the office and get the accurate results right away, that would be different, but we don't. So what happens is that when we see a patient, we have a very narrow window or opportunity to initiate treatment and get rid of this virus very early.
So do you ever start prescribing what you mentioned, the azithromycin, the hydroxychloroquine, and the zinc before the results come in, if in case...
That's exactly what I do. That's my point.
Okay.
That's exactly what I do. And let me tell you what that means. First of all, let's say the results come back negative. So I could do one of two things. I could stop the medication, I'd call up the patient and say, listen, how are you feeling? Okay, and listen, your results are negative. It doesn't really seem to me that you have the virus. Stop the medication. Really no harm done. However, the test is not so accurate. So when it's negative, it's still possible that 30% of the time it's still positive, but the test is wrong. So we have a problem here as well. So what's important is how high is my index of suspicion? It's a clinical judgment. How likely do I believe that this patient has it? And also, how do they feel after taking the medication after 3 days? So if they tell me, listen, this medication, wow, I took it, and 5 hours later I was feeling great, and since then I've been recovering, I wouldn't stop the medication. I would say the test is probably wrong. Finish the medication. It's only for 5 days anyway. So this is the art of medicine, and that's something that an experienced clinician should be able to do relatively easy. So let me summarize again. 3 important principles. One is you must initiate treatment the sooner the better. And I would advise anyone listening to this that in this pandemic, you have any symptoms that it may be COVID, you should not wait till day 4 or 5. You should come in day 1 or 2. Better safe and treat early than to wait a few more days. That's
Absolutely.
Now, the number 2 principle is you have to use the 3-drug regimen. By the way, the NYU study came out yesterday. Again, it was in the inpatient setting, and they actually used exactly my protocol. They used 3-drug. They did a study, a retroactive study, and they studied a group of patients that took hydroxychloroquine and azithromycin, and these are hospitalized patients, versus hydroxychloroquine, azithromycin, and zinc. And they found that the group that had zinc had a 44% less death rate.
Wow. Now, we've seen and heard Dr. Anthony Fauci from the White House Coronavirus Task Force say that the results, at least a month ago, he was saying that the results of the use of hydroxychloroquine is anecdotal, and others in the media have sort of parroted Dr. Fauci in poo-pooing, so to speak, the hydroxychloroquine treatments, and many Democrats, governors across the country, have also been attacking the use of that, associating it with President Trump. What are your thoughts about what's behind the sort of attack, if you will, against using hydroxychloroquine or the opposition to it, especially from the left?
So first of all, let me answer the question of something being anecdotal. First of all, let's define that term. What does that mean? An anecdote, is that a joke, or what is it? It's a story. It's just a aberration. It's an anomaly. What is an anecdotal? Well, let me tell you the data that does exist, and then we can discuss if it's considered. Forget about the word anecdotal. If it's considered significant or not significant. So, the entire country of Honduras, for example, has been using my protocol. I actually set them up. Their Ministry of Health, their president, reached out to me a few weeks ago. I helped them develop the protocol. They actually reached out to President Trump, if you recall, and the president actually made a statement during a news conference that he spoke to the president of Honduras, and they're seeing remarkable results with the use of essentially my protocol. So that's number one. That's an entire country. Then, if you look at Brazil, and by the way, I spoke to the Ministry of Health of Brazil, and maybe I will be speaking to the president of Brazil today. I was essentially asked to lead or collaborate with Brazil's COVID-19 response, and I'm in the process of doing so. But they have a medical system, a subsystem called Prevent, and this system treats around 1 million people, and they treated 1,000 patients with a variation of my protocol, and they found a 95% reduction in hospitalizations. Then, if you go to Didier Raoult in France, it's one of the world's top researchers, he recently put out a study of over 2,000 patients treated with a reduction in death by 90%. If you look at the country of Israel, which I helped set their policy, they have had, it's a nation of 9 million people. It's essentially the same size of New York City in population, and they had 280 deaths. Compare that to New York, which is also around 9 million people, and the deaths are up to 15,000. Look at the country of Italy. Italy had a bloodbath on their hands. The government even made an announcement that they can't do anything for the people anymore. Then on April 4th, I was contacted by one of their bigger media outlets, and I did an interview talking about my approach and the outpatient treatment and early treatment and so on. And on April 6th, there was a change in Italian health policy where they started administering outpatient treatment with a variation of my protocol. And if you look at the data that's available online, there's something called worldmeter.com, I think. It's a website that gives you statistics from all around the world. If you look at the Italian graphs, so on April 6th is an inflection point where the death rates plummet and the recovery rates accelerate upwards. So from the moment that they started taking hydroxychloroquine, their death rates decreased. You look at recent reports from Turkey. Turkey has been using hydroxychloroquine as prevention and or early treatment, and they've just published that they've seen a significant decrease in mortality. If you look at Australia, there's a philanthropist, his name is Clive Palmer. He donated 32 million pills of hydroxychloroquine to the government of Australia, and they started using them in hospitalized patients, but very early in their hospitalization. They have some of the lowest death rates in the world, well published and documented. The country of Iran has reported the use of hydroxychloroquine with great success. India is using hydroxychloroquine as prophylaxis for malaria, and for the number of people that live in India, they have extremely low rates of infection. So I can go on, and I'm just trying to show you that it's not anecdotal when, let's say, 3 physicians or 3 research groups, let's say myself, Dr. Didier Raoult, and in Brazil, 3 separate continents, all come up with the same essential understanding and it's not such a novel idea that if you treat early in a disease process, you get better results. So is that anecdotal?
Absolutely not. I agree with you, Doctor. But Doctor, I have to ask you, considering the success rate that you just went through, country by country, Australia, India, Israel, Honduras, and so forth, with your regimentation of the hydroxychloroquine and zinc and the azithromycin, Do you think that these state shutdowns that we've been seeing with governors issuing stay-at-home orders and the social distancing that's been promoted by the White House, especially from Dr. Fauci, do you think that those measures are unnecessary then if the hydroxychloroquine in combination with the other medications is so successful?
So initially, they probably were necessary simply because there was so much unknown about the virus, and it could have been much worse. So I think it was prudent to be cautious. However, as more information has been discovered and we better understand the nature of the situation, then obviously health policy has to change, reflecting current knowledge. So here's the current knowledge, in my opinion, and I think this should be followed and will make a big difference. That if we create the logistics, first of all, you have to get the medication. It shouldn't be that hard to get a few billion pills of hydroxychloroquine and get enough azithromycin and zinc. You know, when World War II started, this country repurposed its industrial capacity and within 6 months built up the biggest and strongest military in the history of the world. I would think that we can repurpose a few factories and make a few billion pills. It all takes a political will, but we need to get. And by the way, these drugs cost nothing. I mean, they cost essentially $20 a treat. So you can scale that nationally without destroying the budget. Anyway, and they're oral, so you can take them by mouth. You don't need to be in a hospital setting. It's really an ideal approach. Cheap, easy to administer, safe, and effective. So if we treated, and these medications need to be distributed to every primary care doctor and pharmacy. It needs to be available immediately, without any state restrictions, without any fear of retribution or litigation. There's a lot of psychological obstacles. The doctors are afraid to prescribe it because it may destroy their livelihoods, which I understand. So that we need basically an executive order from the president to do a few things. So one is to immediately permit any physician that's licensed to practice medicine or surgery in America to be able to prescribe this medication without any retribution. Number two, we need an executive order that informs and allows for every single pharmacy in this country to be able to distribute this medication with a valid prescription, of course, without any fear of state retribution to their licensure. Number three, we need a executive order indemnifying physicians from litigation for the use of these medications. You know, this is wartime, right? This is World War III. 184 countries are fighting this virus. You know, in a matter of wartime, let's say, if there's unfortunately the concept of friendly fire, where a soldier may, in the fog of war, kill or wound one of the soldiers of his side, and you don't prosecute these soldiers because this is the fog of war, and unfortunately, the nature of war is that this may happen. Same thing now. I mean, you need to indemnify. Doctors are the frontline soldiers now. We're the ones that are exposing ourselves to great risk for our own personal health, and we're doing the best that we can, and we need to be indemnified and protected if there's ever a negative outcome. Because in this litigious society, there are, people are just waiting to find a reason to sue and to destroy a doctor's livelihood. So that needs to be stated explicitly, that physicians are protected from liability if they practice within the standard of care or within reason. You know, I'm not saying you should go and commit malpractice. I mean, that's a different story. But again, if it's a reasonable and common sense thing that the doctor is doing, if there's a negative outcome, the doctor needs to be protected. So basically, we need the president to, in the interest of time, because thousands of people are dying every day worldwide, that we need from a top-down process. We need the president to set the policy and allow doctors in real time immediately to save people's lives.
So if the president does this executive order that you recommend, the sooner the better, of course, but if he does this now, let's say, or in the days or weeks...
He can reopen the economy today.
He could reopen the economy today and potentially even avert the supposed mortality rate that's being predicted by all the prognosticators of a second wave of the coronavirus, like Dr. Fauci and others are pushing.
The second wave is coming. The second wave is coming because we only have, on average, around 15% immunity at this point in this country. So 15% of the population has IgG antibodies. And that's not enough to have what's called herd immunity. Herd immunity requires 2/3 of the population to be immune, which then means that you won't have a pandemic. It means that you may have pockets of infections, but it's not going to spread in an uncontrolled fashion. Now, we only have 15%, which means if and when the second wave comes, it will still propagate through the population at the same rate. So, and we know that there's going to be a second wave. So, but that's okay because we should be prepared for it. The medications need to be deployed, and doctors need to have access. And when it does come, all you need to do is treat it early. And also, I would advise prophylaxing the high-risk patients. So, for example, in New York, for example, some nursing homes report a 50% death rate. So I would prophylax anyone in a nursing home, anyone that's a first responder, anyone that is their role in this war society is absolutely critical. That these patients should be prophylaxed and to prevent them from getting the infection because they can't afford to get it. So, two approaches: treat someone early and treat for prevention the high-risk population. And what's going to happen, you're going to have a 95% drop in hospitalizations and death. And here you solve the respirator crisis. The way to solve the respirator crisis is not to build more respirators. It's to treat people responsibly and appropriately that they don't ever progress to need a respirator. So I'm coming out with a publication. I've been working on it with a group of world-class researchers, and this will be the first publication that it's a retrospective outcomes study, that's true, but it'll be the first publication that reports on exclusively outpatient early intervention and with outcomes. And you'll see that the relative risk reduction or in comparison to different countries, different parts of this country or even within the state, it's going to be approximately 95 to 99% reduction in hospitalization and death.
And when and where will that study be available for us and others in the public to analyze and read that?
Right. So the idea is to publish it in a journal on the level of New England Journal and or JAMA or British Medical Journal or Lancet or something of that caliber. And the researchers that I'm working with are world class, almost on the level of Nobel laureate, I would say, and have published hundreds of medical studies in the top journals in the world. So they reached out to me, and I was very happy about it because I'm not a researcher, I'm a clinician. So they were able to take my data, which is probably the most important data in the world right now, and we're in the process of finishing the analysis, be able to put the finishing touches on the study and then get it published. So that is somewhere between 2.5 to 3 weeks away, God willing.
God willing, indeed. Well, Dr. Zelenko, thank you so much for joining us today on the show and for sharing this information with us. And we hope that, and just to summarize again, your main points here are early treatment with the hydroxychloroquine, the azithromycin, and the zinc is key. And also, if the president were to sign an executive order in which we would bring our manufacturing base of, particularly at least specifically this medication, back to the U.S., make it in World War II levels, and then give that to every doctor or allow every doctor and pharmacist to be able to prescribe that without any kind of retribution on the part of people potentially suing because maybe the medication didn't work for them, that could be a huge key, sort of perhaps even the battle of Midway, so to speak, that turns the tide of war in our favor to defeat this coronavirus. Then
it's an inflection point. We are now at a very pivotal moment in history where, depending on political will and policy, we could turn this thing around and essentially end the global crisis.
Well, thank you so much, Doctor. We, of course, wish you the best of success and God's blessings to you and all of those working with you to get this regimentation applied, not just in the United States, but also even around the world where it's needed, Brazil and so forth. So thank you, Doctor, for joining us today. You take care, and God bless you.